My name is Genia Stewart, and this is my English 300 presentation on the probability of HIV testing among young adults between the ages of 18 through 24. This study focuses on the increased growth of the transmission of HIV within the Bahamian community and the probability of HIV testing among young adults. Human deficiency disease, more commonly known as HIV, is an incurable sexually transmitted disease that weakens the immune system of an infected person by destroying important cells within the body that fight off infections. Young people in society that are sexually active are very susceptible to acquiring this disease if they do not practice safe sex and other preventative methods. In order to obtain credible and resourceful information to complete this study, an electronic survey was created on SurveyMonkey. Other information was collected from library databases, including EBSCOhost. Surveys were issued to adults between the ages of 18 through 24, including full-time college students, college grads, employed and non-employed adults. Questions of the survey focused primarily on the likelihood of STD testing, factors that influence STD testing, and safe sex methods practiced among young adults. A total of 73 males and females participated in responding to the 10-question survey that was posted throughout social media. The answer of each question was ranked from strongly agree, somewhat agree, neither agree, nor disagree, and disagree. 100% of the surveys were completed, with all 73 of the participants being between the ages of 18 to 24. All information gathered through issuing of the surveys was necessary in successfully determining the probability of STD testing for HIV among young adults. The top 5 important questions included in the survey included the following. Question 1. Do you agree that it is important to be routinely tested for STDs, including HIV? Question 2. Have you been tested for HIV within the last year? Question 3. Do you agree that methods of prevention, including condom use and abstinence, are effective in preventing STD transmission, including HIV? Question 4. Do you agree that access to health insurance, a steady income, and committed relationships reduce the incidence of frequent STD testing among young people? And lastly, question 5. Do you agree that the number of sexual partners increases the need for STD testing, including HIV? The results of question 1 included 90% answering that they strongly agreed to the statement, while 10% disagreed. Question 2, 58% stated that yes, they had been tested within the last year, and 42% stated no. Question 3, 40% stated that they strongly agreed, and 60% answered that they somewhat agreed. Question 4, 48% stated that they somewhat agreed, 12% neither agreed nor disagreed, and 2% disagreed. Question 5, 57% answered that they strongly agreed, 35% disagreed, 7% responded that they somewhat agreed, and 1% disagreed. Discussion. Being a young individual does not provide immunity from contracting the disease, and the likelihood of obtaining HIV is just as likely as anyone else. More than half of the participants in the study agreed on the importance of being tested frequently for the virus, although a large percentage of them have not been tested for the virus within the last year. More than half of the respondents also replied that not having a steady income or access to health insurance and being in committed relationships may be a factor that causes the low rate of STD testing among younger adults. More than half of the participants also decided that individuals with a larger number of sexual partners may be the individuals who are tested more frequently for the HIV virus. Let's think about it. Results from the research prove that specific factors influence the probability of testing for HIV among young adults. It has been proven that adults between the ages of adolescence to the ages 24 have a low rate of STD testing, and factors influence this likelihood. However, there is a growing number of young individuals being affected by HIV, and it has been determined that between the ages of 13 to 34, accounted for 20% of individuals diagnosed with HIV in the United States, and 81% of these diagnoses were between the ages of 20 through 24, being the highest number of individuals diagnosed with this STD. And testing for HIV should be practiced every 3 to 12 months, depending on sexual activity. Committed relationships and the number of sexual partners should not depend on the amount of times you get tested for HIV because it does not guarantee protection or immunity from the virus. All adults and adolescents between the ages of 13 to 64 should get tested for HIV at least once. HIV testing should continue to be a part of your regularly testing routine if you engage in behaviors that could put you at risk for HIV transmission, such as having unsafe sex. This is the end of my presentation. These are my references, and I want to thank you guys for my time, and I would prompt anybody that has not been tested for HIV and is sexually active that you go and do so. Thank you.